Well, so far this year, more than $1 million has been raised for a lesser-known developmental disorder known as Angelman syndrome. Well, this is a recent Angelman Syndrome Foundation walk. It happened in Colombia.
It was one of 28 different Angelman fundraising events this year, and it's caused by a spontaneous genetic defect that does not run in families. And as health reporter Anita Brickman explains, it is often misdiagnosed.
At the age of 18 months, Arlington twins Annika and Sophia Bjorkland were diagnosed with cerebral palsy. They started therapy and were fully walking at the age of 2.5. But at that point, their parents and doctors noticed something still seemed awry.
They weren't progressing quite like other cerebral palsy children.
The twins had trouble sleeping and suffered from seizures.
And the doctors and I talked about doing genetic testing at that point.
Both girls were finally diagnosed with Angelman syndrome. It is a neurogenetic disorder that has some of the characteristics of cerebral palsy and the developmental delays of autism. That's why it's so commonly misdiagnosed.
Angelman starts out with gross motor skill deficit and then leads to more of vocal and communication deficits.
David Mittermeier of Capital ABA says Angelman syndrome is often misunderstood even in the medical community. One telltale characteristic that helps set it apart, children with this syndrome typically have happy, excitable demeanors with frequent smiles and outbursts of laughter. Once properly identified, targeted therapies like applied behavioral analysis, or ABA, can help a child with developmental delays and speech impairments.
The most important part is to narrow your intervention focus into the area of deficit you can attack it early, attack it strong, and wait for the progress to come.
With the right diagnosis for her twins, Francesca Bjorkland is seeing a lot of progress as a result of the ABA therapy. The girls also get medication to help them sleep at night and control their seizures.
We've also seen just progression in terms of their ability to learn new skills.
Yay!
Anita Brickman, WUSA 9.
Now, the deal with this kind of issue is that most children are properly diagnosed 2 or 3 years late, which experts say is a lot of lost time for progression that could occur through therapy.